So, Lydia Stone, welcome to the Singing Teachers Talk podcast. And thank you so much for carving out some of your time in your work schedule and your studies for the BAST Level 5 qualification to chat, because you're quite busy, aren't you?
That does seem to be the way that life is at the moment. Yes, yes. No, it's a pleasure to be here.
Well, we're very, very grateful. You are a chartered clinical psychologist with an interest in trauma. And you've worked with both adults and children within this area, particularly specialist in working with fostered and adopted children. And from the outside looking in, it seems to be quite rewarding work, if not heavy. So, how did you end up in the field of psychology, which has also taken you to places like Tanzania and Bangladesh?
Yes, well, I suppose I have to go right back to my undergraduate studies. And it was a broad field then, and actually psychology does provides a lot of avenues, doesn't it? Um, but it was the thought that I didn't just want to study it academically and then leave it behind, but actually do something, apply that psychology, and perhaps the slightly grand and naive idea of wanting to help people through that process. Um, so I always had that in mind. But then there was also the aspect of finishing university and wanting to do something different. So those uh, aspirations took me traveling to Tanzania, where I really fell in love with the country, with the people there. I was teaching English in two very different schools. And from then on, I started to wonder, how can I apply psychology in a way that I work with people, that is exciting and diverse. And the wonderful thing about clinical psychology is once you have the basic training, there are so many different client groups and ways that you can continue in your career. So that just felt really right for me.
And can you help us understand what your job entails?
Yes, that can seem quite an enigma, especially if somebody hasn't had an therapeutic encounter, let's say, with a psychologist. So day to day, at the moment, as you said, I'm working with fostered and adopted children and families. So just looking at my appointments this coming week, what my day looks like, I'd have a lot of appointments with parents and carers, where I'd meet them for kind of an hour at a time to talk about their child, talk about understanding their child, how psychological models can help with that. Then, once we have that understanding, how does that help us as parents and carers? What do we do with that? Um, or I might have sessions directly with young people and again use different models of psychology to support their goals. What do they want to change, make better in their life? It might be family sessions where we have the parent and carer in together with the child or young person. But also there are meetings with other professionals like social workers, doctors, my colleagues in child and adolescent mental health services that work in the NHS. We might talk about our work with a family or a topic that we're noticing is becoming important. Um, we also do teaching, so it might be a teaching day where I've got a whole group of people that I'm telling about a particular topic, or a course that I'm leading through. I've just started one with adopted parents. It's a very long course and we meet every Friday, and that might be something that I do as well.
Mm,
And of course, the everyday tsunami of emails that everyone gets.
yeah. And because of what you do you find yourself in your day to day being able to respond to people's behaviors or reactions more balanced? Like if somebody just looks like they're being a knob, are you able to actually think, you know, this might be the case, or actually I can see that might be influencing that person there? Or do you sometimes just think, nah?
Well, I would love to say yes. I'm always calm and thoughtful. Sadly, I'm a human being, so that doesn't always happen. I think what I've realised is so much to do with how I'm feeling, and as a human being, there would be a day when I could be thoughtful and think more psychologically, oh, I wonder what's underneath this, what's really going on, because they're clearly not really hating me, or, I hope they're not really hating me. But of course, then there are other days when I'm not feeling so great, or something about me is triggered. We all have our own idiosyncrasies and our personalities, things we like and dislike, things we're used to and we're not used to. And then it's much harder. I might react much more instinctively, just think, no, I can't be bothered, go away. That's the reality, isn't it?
Lydia, I am a self-professed bookworm. I can't go out without a book. I fear the day that I'm on a train that breaks down and I don't have one with me. So it's always there, tucked in my handbag. And I was devastated by one most recently called A Little Life by Hanya Yanagihara. Have you read it yourself?
No, but I have heard colleagues talk about it.
It's rather devastating, and I felt my innards become displaced. It was a heaving sobs in the bath type of book. It's also been adapted for stage, having a West End run at the Harold Pinter and Savoy Theatres, directed by Ivo van Hove. If you haven't seen the play or read the book, it's centered around a character named Jude St. Francis, who experiences unimaginable trauma, some of which has happened in his early life. And we see how that impacts his relationships and his decisions and his thoughts as he's grown into adult life. It's actually a book that I saw, I think, a psychologist mentioned that it's changed the way they work, which is quite powerful. You work with children who, like Jude, this character, has experienced that early trauma. So firstly, can you help us to understand what we mean by that word, trauma?
Yeah, I'm really glad you asked that question, because it is a word that we use much more colloquially these days. We can almost joke about it. Oh, I was so traumatized over the weekend, when we probably don't mean we really were. So the kind of psychiatric and psychological definition of trauma has to do with experiencing an event where we feel either our very life was threatened, or something very significant about our core being, whether that's our bodily being or something about us, our very self, has been directly threatened. And that can be a direct experience, or it can be witnessing something that has that threat involved. So it does have to have that part of it. And also, we have to react to that with a sense of hopelessness, helplessness, horror. And both those things have to be in place for us to, as psychologists, for us to define that that was a traumatic event that someone went through. And I think it's quite useful to think of that developmentally, because an event that a baby experiences as traumatic perhaps wouldn't be one that a teenager or an adult or an older adult experiences, or maybe an older adult might, but a teenager wouldn't. So, for example, being left alone for a baby is traumatic. We're so helpless when we're born. We need a very responsive adult who's going to notice us, who's going to make sure we don't roll in such a way that suddenly we're going to suffocate. For a teenager, it doesn't matter. They want us to leave them alone. That's certainly not going to be traumatic. For an older adult, it might be. Again, they might be at a very vulnerable stage in their life cycle. So we have to think about that. And another part, I was just reading a really seminal work by Bessel van der Kolk, which I really recommend people go to. It is quite a tome, but it's a great read. It's called The Body Keeps the Score. He's a psychiatrist, but it really explains the world of trauma and how it affects our body and psychology very well. And he was also saying how the element of trauma being inescapable is very important. So if we can do something in that moment, have some agency, we're less likely to have long-term effects. Whereas if we can't, and as children we often can't because we don't know how to escape or cope with things, and certain events in adulthood as well, of course, we have those kind of characteristics of an event happen to us, then it may lead to a trauma response.
So, how might this impact cognitive development or learning in the child compared to one who hasn't experienced trauma?
Yes, we can never say that a traumatic event will always, kind of in quotes, traumatize a child. We're also different. Our personalities, our vulnerabilities, how we receive support and cope after a traumatic event is so idiosyncratic and different. So one person's traumatic experience may not actually lead to a longer term impact. We have inbuilt resilience, but we certainly know that there's a lot of research and evidence now that unfortunately some people are very vulnerable to their whole development being affected by early trauma, which means that cognitively the brain becomes very oriented towards threat. It's not able to learn about the diversity of the environment, including relationships and exploration of what is so wonderful about our world. Instead, the brain is just thinking, how do I stay safe? How do I look after myself? Or how do I keep relationships safe? It's not able to have a balance between kind of inward security and an outward exploration.
A lovely vocal coach who we've had on the podcast, Claire Delaney, she's been very bravely open on her social media about her experiences of PTSD and how that's affected her vocally. So, how might such events or experiences show up in people vocally and physically as well in their body?
I think, again, we're learning more and more about that all the time. So we know that while the brain may have changed, also the body is so intrinsically linked to how our brains are developing. So if our brain is oriented to threat, so will our body. The body will be going into a fight or flight or freeze state or even a kind of collapse state. And again, that can prevent healthy development. Unfortunately, we know that for some people who have those vulnerabilities to be affected by trauma, their long-term health is significantly impacted. There's statistics about cardiac function and chronic diseases like diabetes that we see a lot more prominently in people who've experienced particularly early and chronic childhood trauma. That is one thing that, of course, just general health is going to affect somebody wanting to use their voice. But also more acutely, we could imagine that if you're in a threat state, your adrenaline's high, your body is prepared for some kind of danger, well, a lot of muscles tense up. And what I'm learning in my study of singing is, of course, tension is something we want to have control of. We want to be able to choose where we're tensing and engaging muscles, whereas this isn't that kind of process. It's an all over body tension. Certain things are going to get, certain muscles are going to be engaged and ready to run, or vice versa, to kind of freeze and collapse. And it's quite hard to have control over one's body in that moment. So I imagine that's what we might see if somebody is either in a kind of chronic threat state or something particular has triggered them while they're with a teacher or singing, which would make even somebody who perhaps had good vocal technique suddenly not feel as in control of their performance.
How might this also impact the relationship building and ultimately the teacher-student relationship? Because it's quite a special one in that singing room. What might we see there?
And that's a really important question, particularly when we're thinking about early childhood trauma. That's very often where the difficulties lie. Either somebody's had abusive experiences within important relationships, or they've had some experiences where there's been a lack of nurture and responsiveness from an adult to support them through things. So I think it would most likely show up exactly there in the relationship with a teacher. So we might get a general sense of mistrust and distance. It would depend how somebody's learnt to cope. when we think about trauma responses and attachment, we look at different strategies in certain ways. And one word that's used about those strategies is avoidant. You try to kind of withdraw and distance yourself from other people to keep safe, not letting people in close. So you might see that. Or vice versa, you might see somebody who's rather worried about what is going to happen in a relationship. So they may try and control it, or maybe be more emotional just so that they can make sure they keep your attention, that they're worried that perhaps you won't really be that interested and that you won't be able to help them. So I suppose you have to have open minds to what's going on in relationships and show some curiosity, try and be empathic while noticing what's going on.
How much information does the teacher actually need to know? Do you think that this sort of experience should be disclosed to us, or do you think that it's not necessary?
Yes, I was thinking about this kind of issue. And I mean, fundamentally, it's somebody's personal information. And we're not in a clinical setting, we're not in a health setting. It's completely up to them what they share. I suppose it could be helpful to have in a kind of assessment or intake form that kind of open question, is there anything else that would be useful for me to know? Or are there any struggles, even of a sensitive nature, that you think it'd be helpful for me to be aware of? Something like that. But fundamentally, it is such a personal thing. And already coming to sing with someone, we know it's such a vulnerable experience, opening your mouth and, your voice is you, isn't it? It's part of you. So yes, I would take it very gently and not have any big expectations about that.
Mm. When we were speaking with Dr. Shannon Coates about building neurodiversity inclusive studios, she was coming from the point of view that actually the way we teach could mean that we don't have to ask those questions. It just means that we're inclusive to anybody who comes into the studio and they don't have to actually disclose anything. So if we are noticing that a student is maybe backing off the relationship a little bit, not building a particular trusting element in that partnership, what could we do to help that?
Yeah, I mean, that's a big question. And I think the first thing I would say is uh, to not take it personally. It's much easier to say than do, is to be open and curious about our own feelings as well as perhaps the students. So to think that nothing is beyond repair as well. If you're experiencing that kind of withdrawal from somebody, that doesn't mean that's it. Oh, they hate you, they don't like you, or they're preoccupied with something and that's it, it's over. In my work, the team where I work with children who do experience these difficulties with relationships, we talk again and again about how any kind of rupture in the relationship is kind of an opportunity to repair it and draw closer again and help the child to understand that, bad things happen, but you can repair them and get over them, which they may not have experienced before. There's a really great approach, and if you just put it into your search engine on the internet, you're bound to find things about it, called PACE. So capital PACE. I don't know if you've come across that before.
No, I don't think I have.
Okay. And although it is theoretically focused on supporting an adult's relationship with a child, you can pace anyone. So the acronym stands for playfulness, acceptance, curiosity, and empathy. And it's just using this attitude. So when in doubt, maybe something's going on, you're thinking, hang on, this person is suddenly not with me in the room. Maybe they're completely distracted and I don't understand what's going on, or they're suddenly withdrawing from me. It's like they don't want to engage in this conversation or this focus that we had the moment ago together. So to think about, well, how can I lighten this moment? How can I be playful with it? Whilst also actually accepting that's happened. Oh, what's happened? It feels like we're having a bit of a moment. Do you need a break? So just to name it, accept it. There's no point trying to kind of fudge over it. I think it's okay just to very briefly name it, make a little bit of a joke about it. Um, Show some curiosity. So that's the C part of pace. I wonder what could have happened. I noticed that you can make a bit of a guess. I wonder, was it because whatever, you noticed something out the window, or there's a sudden loud noise. That was just, the neighbor doing some drilling or whatever it was. And that really put you on edge. And that empathy as well. Gosh, it would put me on edge too if I wasn't ready for that. And you don't know me very well. It's just our first lesson. That kind of conversation, to see use that attitude. And it may not be a kind of magic wand in the moment. If somebody really does struggle with regulating their emotions, that it may be difficult for them. But just hearing that, you may find that person is more likely to come back another time, even though they have been set a bit on edge by something that's happened with you.
I guess also if you're bringing it up and you're acknowledging it, it's letting them know that it's a safe space to be able to explain how they're feeling, or that you're interested or reading
Right.
them well.
Yeah. And people often worry about, oh, but I might get it wrong. I might try and be accepting and curious, and I might get completely wrong. And that's okay. Because I think if you do it with gentleness and empathy, that's all right. Usually the other person will tell you if you get it wrong, or if they don't, they will appreciate that you're having a go. You're thinking about them. You're not haven't just got your agenda in mind. You're being thoughtful.
Yeah. And when it's the other end of it, if you like, if there's somebody who may be becoming quite clingy or showing that they're really wanting to please, maybe overstepping a bit of a boundary, will pace apply there as well? Or is there another way to go about things?
Yeah, I would say yes. It can feel less comfortable. So there are some situations where you can just feel that, "Oh, surely I can't use this pace approach here." Maybe if someone's angry, or yes, they're actually breaching some kind of boundary. Um, but I think you can. Oh, I've just noticed that actually you're starting to get really physically close to me. That's okay. But usually when I have my students, or usually this is what happens. So I wonder what's going on for you. So it's about trying to be accepting, empathic, curious, whatever it is. And actually, if it's something where you don't know what to do, I would say that's okay. We can't, you're not, we're not talking about everyone being an expert therapist. That's where it's really helpful to have a mentor or someone, another singing teacher that you can just share those experiences with, and get your own support with it, and advice from others.
What other signs might a singer be showing who may have experienced trauma outside of the studio room that we might want to be aware of?
Of course, there's lots of different things, but I suppose some of the more common ones, if I'm thinking about what I see with children and young people, even adults, because of course, working with parents who might have experienced their own trauma as well, you might see people very distractible by noises or other sensations, um, very active and kind of agitated or jumpy, more than you would expect. Um, or vice versa, somebody who's suddenly kind of yawning a lot and kind of very floppy. And that might show that they're going into a bit of a kind of collapse freeze response. All of this, I would advise, take with a pinch of salt, of course, because, they could have just had a late night. That might be why they're yawning and floppy. Or they might be really excited about a date they're having later that day. That's why they're a bit keyed up. But they are some little signs that you can especially notice over time if you're having more than one meeting with somebody. Um, and again, the interpersonal things, suddenly avoiding eye contact, or just their facial expression changing. I'm just thinking I was having a singing lesson with a young person and asking her to, as we do, make some slightly strange sounds sometimes. And this was really different for her. And she said, I don't like how it sounds. And she didn't quite look tearful, but her facial expression just changed. And I thought, I think it's better to be tuned into this and just pause, just give it a little bit of time, not just go straight on, power straight on through, but just acknowledge this, be a bit encouraging. And it was very subtle. So again, have a little bit of trust about your own feelings. If you're suddenly feeling something, it's probably that something really has changed in the room. Um, Especially if it's a bit out of the blue and you suddenly notice, "Oh, why am I suddenly feeling awkward and a bit nervous of this interaction?" Just to give that some time and check things out.
I'm just pressing the pause button on the podcast for a very brief moment to invite you to book your free BAST call. If you've been thinking about joining the BAST community through one of our courses, but you just don't know which option is the best for you, then why not book your free Zoom chat with our very own Kimberly George, who has all the answers. Head over to basttraining.com/book-a-call/ and click that big blue button. That's basttraining.com/book-a-call/. Now, where were we?
So you mentioned before about how somebody who might be quite keyed up could just be looking forward to something going on later on in the day. And equally, if somebody is a bit floppy, it could just be they had a late night. So how can we differentiate between a singer who might just be having a bad day and is in a bad mood compared to someone who might have a deeper issue going on, and how we then allow the lesson to continue in the most appropriate way?
Yes, I think the answer to that is you can't fundamentally know the difference unless you know that person really well. It is about getting to know people over time. Even when I first meet children, young people, families the first time, I can observe what's going on. I can have absolutely no idea. Is this person in a slightly uncooperative, irritable state? Because actually it was really stressful getting here and they couldn't find parking and so on. I am going to need to meet that person again and see, are they still in that same state next time I meet them? Then I'm going to start thinking, something here going on that's more about them as they generally present themselves in everyday life. And then I guess you would think, oh, I wonder what this person's experienced in their life to make them this way. Do they always have a nightmare parking on the way? So I guess if you've noticed it more than once, to bring it up once you've already got a bit of an established relationship with somebody, you can, bring it up peacefully with that kind of like, oh, I just noticed, is everything okay? And then see where that goes. And I think when you feel that the communication isn't going well with someone, they're still coming back to you, but they're struggling with some of this interpersonal stuff, then you might think there's something deeper going on. But of course, it's not our role as singing teachers to label that, to do anything about it. They want to keep coming back to you. It's something you're going to have to find some tools to still work with, as you mentioned, and pace would be one of them. And I'm sure, lots of other ideas that might be informed by an awareness of neurodiversity, trauma informed, and so on.
In the vocal health education program, Petra Raspel-Borzinski talks about this idea of the window of tolerance and how we can maintain that in a session and look out for when a singer is maybe leaving that window of tolerance. And you've spoken a little bit about facial expressions changing, but what is the general setup that we can implement? And I know everybody is probably going to react differently to things and need different things at the same time. So what would you advise there?
So the literature that talks about being trauma informed would start by thinking about basic needs. Have we created an environment where basic needs are being met? So a safe environment, food, hydration. So you might just want to ask your student about those things, or have some water available. think about the noise. These are really basic things, but actually for somebody who's experienced trauma, it can be massively distracting if there's a kind of little low rumble somewhere. You might find that because their brains are in this threat state, people who have experienced trauma will be a lot more aware of these little things in the environment. So just to be thoughtful about that. If there is something going on that's outside of your control, just to name it and apologize for that. So that's much better than just kind of trying to ignore it and, carry on. This is all right. We can cope with it. So that's one thing. I think there's just having an awareness of the environment. Is it basically safe and welcoming and soothing? Is it helping your singer to not have to worry about all these other things, but be able to just focus on the task in hand? And I think another key concept is choice. So we may think we know what feels safe, but actually that may not feel safe to everyone. So to just show an openness to what the person wants, either in the environment or as we go through the structure of a lesson. So to have that really light touch, think about collaboration. And these are all basic principles that I think we talk about all the time, but it's just particularly important to remember them when we want to be trauma informed.
How would you advise that we help singers select repertoire, or what considerations do you advise we have for providing repertoire to singers? And bearing in mind, we might not know if there is an issue with a particular topic or a particular song even that might have repercussions down the line. What would your advice be to us?
Yes, I think we need to talk about emotion more. Not what by what that I suppose I mean, we often can talk about emotion quite a cognitive, cool way. So how did that make you feel? I don't know, sad. And then we might talk a little bit more about it, but in quite an academic sense. And I wonder whether it can help to slow that down and embody it a little bit more, and to say, well, tell me about a time when you sung songs on this topic before. Really just maybe take a moment to really remember what it's like. You're standing up and there it is, the song's there and you're about to sing it, or you're in the middle of singing it. What does it feel like in your body to sing a song like that? What does it mean to you? Does it resonate with you in any way? To kind of go there. And of course, that may worry some people because they think, oh, that person's going to get really emotional in the session. Well, they might, but hopefully you're creating a safe enough space that's okay. And also, we have to remember that this person will be dealing with these kind of emotions a lot of the time anyway. It's better for us to provide an opportunity to address it, name it, think about it together, rather than not talk about it and then it suddenly pops up because we haven't prepared for it, and all of a sudden there was this song that happened to have a personal resonance, and it was only when we got to this little section that it all went completely pear-shaped because it was a bit too much. So to not be afraid to talk about that emotional element in a bit greater depth, I guess.
I think that's the thing, isn't it? Because we aren't therapists as singing teachers, but a lot of the time we sort of have a little bit of that going on in the session. I think there's a sense of us wanting to maybe sometimes avoid upset because we don't know what to say, what to do, what we're allowed to ask, what we should then do next. So what would you say to us singing teachers about that? What is actually within our role to do? I mean, you're a clinical psychologist, so you've got more of that capacity to go there, whereas somebody like myself, I don't have that. So what can I ask? What do I have the capacity to do?
I think everyone has the capacity to be a kind, compassionate human being. It doesn't need to be anything particularly more sophisticated than that. And I'm always struck by things that I hear when I go on training, which is about trauma-focused therapy. So often I have heard the trainers say, therapists are worried about re-traumatizing, and this may be something that's going through teachers' minds as well. If I start talking about these things, I'm going to bring up some horrific memory and I'm going to re-traumatize this person. Actually, people are living with trauma already. If this is still affecting them on a day-to-day basis, there are all sorts of things that are constantly re-traumatizing them that are not necessarily even people, their sensations, their colors, their sounds. So to think that we can be so powerful and be the re-traumatizing ones, of course, if we've used really pejorative language and we're really threatening to someone, that's going to be understandably upsetting and distressing. But if we're trying our best, we're explaining very clearly to someone what our role is, even if there is a, in quotes, re-traumatizing experience, I wouldn't worry too much that it's all something to do with what we have done. It's something that person is living with already. And at least we're there trying to give them this different experience, in this case of singing and enjoying music alongside that.
For singing teachers who are in an institution, they'll likely have a safeguarding team that they can go to report things or bring something up or chat to somebody about a student. For solo singing teachers who are purely based privately, it can be quite a worrying idea that they will be faced with a safeguarding issue that they then need to report. Can you help us to understand what that process is as a solo private teacher?
When we're talking about safeguarding, we really want to think about sharing risk. So sharing risk of harm, meaning sharing information in an appropriate way. But I think the first thing to say is that there are certainly trainings out there. And I think if you're working with children as your main client group or any vulnerable population, it's always a good idea to do a bit of safeguarding training. I think the NSPCC runs it. It's really not expensive. It's online, just gives you the basic information. And I think it may be something that you just renew every 3 to 4 years to make sure you're up to date, that there's no legislation that's changed, that it's helpful to be aware of. That's one thing I would recommend doing. And then after that, just having the number of your local social care service. There's often a kind of front door where anyone can phone up, and it may vary from locality to locality, but very often you can do what's called a no names consultation, where maybe you've experienced something with a student, or you've witnessed something with how they interact with their family, or something they've told you about other things that are going on in their life, and you're just a little bit worried. You're thinking, that doesn't sound good. That sounds like there's some harm going on. Even if it might not be about them, maybe they're talking about somebody else. You can ring up a number like that and have a no names consultation, where you might say, I don't know the name, or I do know the name, but I'm just not sure if I should be reporting this. This is the kind of thing that's going on. And hopefully there's a social worker at the end of the line who can say to you, oh no, don't worry. You don't have a responsibility to share that. It wouldn't reach our criteria, our threshold. So thank you, but that's the end of that. Or they might say, actually, yes. Do you have any way of finding out any more information, or could you give us some more detailed information? And the main thing then I would advise is to tell your student what you've done. It's always best to be transparent and say, I'm really sorry. I was just worried about you, and I felt I just had to get some advice about that. So this is what I did, and this is what is now happening. It's always best to be honest rather than try and kind of fudge things and cover up. So I think those would be the basic things that I'd advise.
Yeah. And sometimes the student might ask us not to say anything. And I understand that actually we can't promise that we will document an event, and we can't promise that we won't.
Absolutely. You know, singing teachers are not therapists, so they certainly shouldn't be promising confidentiality. And even therapists, we have limits on our confidentiality that we explain very clearly to our clients. When there's a risk of harm, we tell them, I won't be able to keep that confidential, but I'll always let you know what I'm doing then if I'm worried about that and have to break confidentiality. So I think as a singing teacher, you should definitely not feel that you're pressured not to share information. It's always better to share that sense of worry and risk with other colleagues and professionals.
Does the no names place also apply to adults, or is that for children
Yes.
and young? Yeah.
That's right. It applies to all ages, yeah.
For growth mindset or confidence, I usually encourage a singer to reframe a harsh self-judgment in the moment or conclude sessions with a confidence finisher, so getting them to acknowledge something that they did really well. Can this still apply in cases of experienced trauma or expected trauma, or does that feel like a patronizing thing to do? Is there a more suitable strategy?
I think it's really great that we're thinking and aware that, oh, that might be a bit glib if we actually think there was something quite difficult that happened in our singing and our lesson experience. I do really like it. I think it can sometimes, it doesn't need to have all gone very, very well to still have a kind of positive finish. I think as long as you've got this acceptance that something really difficult happened, you can as well have something positive and strength-based at the end. You know, humans, we're pretty messed up, and yet we're so marvelous at the same time. So you can have that contradiction together. And sometimes if it really doesn't feel right, the kind of thing I might do with a client in a session would just be to say, you know, what are you thinking about as you're going home? What's really important? What's been really thought-provoking and important from what we've talked about, or from our lesson today, in this case for a singing session? And then you're still trying to get some kind of strength and learning from it, even though it might not be something that's necessarily, like you say, a kind of confidence boost, because it hasn't been that kind of experience.
For teachers working with singers who have experienced trauma, how do you advise that we give the appropriate level of concern and attention to that person in the session, but then which doesn't move outside of that boundary afterwards, coming a bit encroaching on our own mental health? And I guess it doesn't even have to be a singer who has experienced trauma. It could just be anybody at all who we meet in the studio.
I think it's important to remember that we might have a therapeutic role as singing teachers and mentors, but most of the time singing teachers are not qualified therapists, so they're not having supervision where they're talking to another therapist about how they themselves are feeling personally and how it's affecting them and so on. But just to be aware of those boundaries, it is really important to keep professional boundaries for everybody's sake. And if you are feeling that something is affecting you personally, to not ignore it, to notice it, and think about either seeking advice from somebody else, or just making sure that you are looking after yourself. There are some people's stories that particularly affect us. I can say that for sure. I can be talking to some children and families about horrific experiences they've had, but it's kind of all right. And then suddenly a story will come along and it just touches me, and I can't even always explain why. And I just need to take a little bit more time and effort to have compassion with myself and give myself time, and do all the things that hopefully we know help ourselves. Look after ourselves physically, give ourselves a rest, do the things we like to do, talk to a close person about that subject. So just to acknowledge and accept it, rather than just thinking, no, I'm just, this is my job, and so I shouldn't be affected. I'm just going to plow on.
throughout my education, I've witnessed teachers guided more compassionately and teachers who are somewhat harder in their approach. We say tough love, probably is the nice way of saying it. In your opinion on in your opinion on the two, when is it ever appropriate to take that more tough love route?
I mean, I guess, again, I would say this shouldn't be an either or situation. So when I'm talking to parents, we talk about the two hands of parenting. If you only do one hand, it's probably going to get you into some sticky situations. So the two hands are on the one hand, the caring, nurturing, empathic, understanding side. The other hand is but you still got to do your homework. I want you to do your practice. This is what I'm hearing, and this is the effect on your voice, for example. If we only do one, it's not going to be nearly as effective. And of course, the people who we remember and who inspire us, whether they're teachers or just relationships in our life, are the people who somehow do both together, who can somehow be firm, boundaried, and yet very warm and nurturing with it. And I guess that's what we should be aiming for. We won't get it right, of course. We'll be making lots of mistakes along the way. And that's where we need to remember, it's okay, I can repair this. Repair is always an opportunity for something for me, for the other person. But having a think about these two hands of, maybe it won't be parenting, of course, in this case, but of relationship building.
We've all been there. A student doesn't practice or hasn't prepared for the session as you'd hoped. It's quite easy for us to label that as, laziness or disinterest. But from your point of view as a psychologist, is it ever really purely down to those things, or is there something else bubbling under the surface?
Ooh, I'm sure there must be times when it is purely down to those things. We all have lazy moments, but we could probably always look a little bit further underneath. Well, why do I feel lazy? Oh, well, it's because this happened the day before, or actually it's the end of a really long term of study or whatever. I suppose it relates a little bit to your other question about, is somebody just having a bad day, or is this a recurrent pattern where they're, maybe won't call it laziness, but lack of effort? It is just how they deal with life, how they distance themselves from achievement because they're frightened of failure, for example. I think it's always good to try and be curious about underlying issues, and just to, think. I don't want to be labeling here. I want to be curious. That should be our kind of basic stance, I suppose.
Yeah. So could we use the pace thing and say, I've noticed that there's been a pattern of, there's a lack of practice, or you haven't brought your rep folder to session. Is there anything going on there that we might want to address?
Exactly. And if you do it with a bit of playfulness, empathy, you're doing that, just you're curious about it. You want to know what's going on. You're not saying, this is really not acceptable because I know you're just being lazy. I mean, not only are the words pretty terrible, but you can even hear how my voice changes, and all that non-verbal communication around that is a completely different experience. So yes, or if in doubt, use pace.
But how do you do that, but also settle this infuriation inside that you're like, come on, just do this thing?
Yeah.
But communicating kind of curiosity and empathy.
Yeah, well, what we talk about a lot in our work, just within my team, but with parents perhaps who are trying to use pace with their children, is unless you're viewing pace with yourself first, is you've got your own emotions regulated the best you can, then it's probably not worth even having the conversation. It's better just leave it to a time when you are regulated, when you are feeling calm, and even if you're feeling frustrated, you can rein it in. And it's okay. It's much better to choose and have the conversation at the right moment rather than to have the wrong conversation, but out of frustration and anger. So you can just use pace. That strike when the iron is cold. That's another phrase you can think.
Yeah. I'll just have a minute in the corner, be like, I just need to pace. I'll be with you in a second.
Yeah.
You've mentioned a few resources throughout this chat, Lydia. What would you say would be great things for us to go and look at on this topic?
Yes, so I actually brought along, this is the Van der Kolk book that I mentioned. So that's The Body Keeps the Score. That's a really good general overview. But there are some good websites. There's the UK Trauma Council, which has some really nice little videos which talk about how trauma affects children's brain development, but also particular types of trauma, for example, trauma-related aspects of being a refugee or traumatic loss. So that's a good website to go to. There's a therapeutic, what do we call it, institution called Beacon House. Again, just Google that, make sure you've got the right one, because I think it's also that there's different Beacon houses, but if you go for the Beacon House in the UK, it has loads of great resources, not only about child development and trauma, but how that can affect the child in the classroom. So it really relates it to teaching, and it really relates it also to the body. And for example, even there's a very specific section about how the mouth is affected, sensory development, which is just really great to look at. And it gives little tips, little exercises and activities you can do that will just support that child, that young person when they're with you.
Lydia, I'm sure that you may have noticed, because you're going to be very good at reading people and you're a psychologist, but I've been quite nervous throughout this entire interview and found myself stumbling quite a lot. Is that normal?
I wouldn't have said that I thought you were nervous necessarily, but I did notice that your tongue was kind of tying you in knots a little bit. I can't even say it myself. Hilarious. Yeah, and I was thinking, isn't that interesting how the topic of trauma does that? And it's not unusual. And our bodies are just already that tiny little bit like up, a little bit more alert, a little bit more on edge. The primary thing is not just reading the script and asking the questions. There's a part of the brain that is thinking something bad might happen, because this is our topic, it's trauma. And immediately our body is affected, and it's hard to talk as smoothly and in such an articulate way because part of your brain is ready for something. Isn't it interesting? And it's certainly not unusual for that to happen.
And so is that because it's just that topic, and because we're talking about vulnerabilities and being ready to fight, or is it because there's some underlying issue that I haven't addressed in my life?
I'm not going to diagnose you on the basis of a few stumbles of what you're saying. I think at baseline, it's just the topic. Who knows what I might say? Who knows what that might bring up for you? Well, I think very few of us have had a charmed life where we've never experienced anything that was slightly traumatic, maybe not in the absolute diagnostic sense of the word, but like a tiny trauma. One of my friends and colleagues has recently written a book called Tiny Traumas, where it's about the little things that the accumulation of can lead to distress and might be helpful to be aware of. But yes, we all have a little bit of connection with trauma. And so when that topic comes up, we will find ourselves affected. And I think it's good that we are. We're not robots. We're not completely devoid
Not
of
yet,
emotion.
Lydia. Not yet.
Yeah. Yes, and all good that we're not.
Yeah. I think it links back to what I was saying earlier about avoidance, and how if we avoid it, at least we won't say anything wrong. And I feel like that when we talk about topics like this, it can feel like one slip and you might be cancelled or judged or be deemed as not understanding something. But I'm really glad that we've had somebody like you to come on to the podcast and give a really curious, empathetic and insightful viewpoint on trauma and how us singing teachers can help in the singing room in a way that is within our role. So thank you so much.
Thank you.
Great. Oh, Lydia, how do you fit this all in? You're doing the BAST Level 5 qualification. You've got a job that is, a lot of brain power, a lot of focus, a lot of empathy. How do you have a family? How do you make room for it all?
Being a little hyper organized, being quite focused on the control aspect of it, and how many hours are going to be allocated to everything, and really trying hard to have weekends off, completely off.
Yeah.
It's if you learn over time that there's going to be a personal and a physical toll otherwise. Really, you have to take that seriously. So it's just the boundaries for work and play, very important.
Yeah. And how is it going with the BAST Level 5?
Yeah, great. I mean, it's very intense, but it's just amazing. And when I look back about from when I started to now, I can really see how things are really coming together. And I am now starting to imagine how my experience and interest in psychology could really come together in the singing world too. It's interesting.
Well, Lydia, where can listeners find out more about you and the work that you do and get in touch with any questions?
So I'm more than happy for people to contact me. The best contact would probably be drlydiastone@gmail.com. So all one word. Dr. just Dr. Lydia Stone. If you're interested in the work that my team, not my team, but the team I work with does in Oxfordshire, we're called the Attached Team. We're under Oxfordshire County Council. So again, you could find us that way. And then at the moment, I'm directing a gospel choir. So you can have a little look at a photo of me and my fellow gospel choir enthusiasts there. That's Tyndale Community Gospel Choir. Also, a quick Google will help you find us.
Amazing. Lydia, it's been a real pleasure to chat with you today. Thank you so much for your company.
Likewise.